Hello, everyone, and thank you for joining us today. My name is Pam Dunwald, and I'm one of your nurse advocates, and this is Tuesday Tips. And I'd like to start out with just a powerful quote from the World Health Organization, and I think it truly sets the stage for our discussion today. So, dementia is not a single disease, but an umbrella term for a range of conditions characterized by the progressive impairment of memory and other cognitive functions. It affects over 50 million people worldwide. And that's going to be our theme as we go into June. It is Alzheimer's and Brain Awareness Month. So we're going to be focusing on tips and strategies about what we're going to bring and share for you for this month. And so, first, to get started, just an introduction to dementia. Dementia is a really a complex condition. So let's start with a very clear definition of dementia. So dementia is a collective term used to describe various symptoms of cognitive decline, such as forgetfulness. It's not a singular disease, but it includes multiple conditions like Alzheimer's disease, Lewy body dementia, vascular dementia. So it kind of brings in a whole myriad of different types of dementias that can have different symptoms themselves. But dementia in a whole is kind of like that umbrella for all of those different types of dementias. So the impact of dementia extends really beyond the cognitive function. It affects emotions, behavior, irritability, the ability to perform everyday tasks. For caregivers, this challenge can be very, very immense. Managing difficult behaviors such as sundowning. Sundowning is often one of the first signs of dementia. Is that towards the end of the day they become more confused, they become more irritable, they could have behavior issues. We see that a lot in the hospital when patients, maybe in early stages of dementia, are taken out of their very familiar home environment and now put in a hospital where lights are on all the time, and it's just a breeding ground for those patients that are at risk for sundowning, to have sundowning. And we're going to talk a little bit more about that in our social media posts coming up this month. So managing aging loved ones with dementia is truly a difficult task. And I applaud all of you that are taking this on your shoulders, because it is extremely rough. So let's look at what maybe some early signs might be, recognizing the symptoms of dementia. So we're going to look at memory loss that impacts or disrupts their daily life. For example, I'm going to talk a little bit more about this particular client of ours, but she was able to recognize early on that she was having difficulty with memory issues. She had not been to church for a while, her and her husband, very avid churchgoers. She would hold Bible study at her home and things like that. And so it was unusual for her not to go to church. And she asked me to come over one day after church, and she said, I have something I'd like to talk to you about. And so, of course, I went over there, and she says, you may be wondering why I haven't been going to church lately. And it's because I've been to the doctor. They've diagnosed me with Alzheimer's disease, and I don't want to go to church because I'm deathly afraid that I'm not going to be able to remember the names of people at church, people that I've known for many, many years. That would just be too embarrassing for me. Can you help me? So that was the first introduction to the very beginning stages of that client. And we'll talk a little bit more about Mrs. D later, but she went through the 7 stages of Alzheimer's disease very quickly within like a 9-month period. And some people take years to go through that. So that was a bit of an unusual case. So we're looking at poor judgment leading to bad decisions. Could be maybe while they're driving the car, could be while they're cooking, could be doing any one of different things. Loss of spontaneity and sense of initiative. They just seem, in the nursing and the healthcare world, we look at them as being flat. And I know that's a technical term or a healthcare term, but it just means like it's almost like they're kind of blank, that they just seem kind of indifferent to everything. Another thing would be losing track of dates or knowing current locations. That was another one of Mrs. D's issues early on, is that even though she wrote the dates of doctor's appointments on the calendar, she was forgetting to check the calendar and she was missing doctor's appointments. Taking longer to complete normal daily tasks just because they might get halfway through a task and just really like kind of just totally blank and have to just kind of regroup and say, okay, walk themselves back from the beginning and see if they can get through. Repeating questions or forgetting recently learned information. I think this probably can be one of the most frustrating things for those that are caring for family members or loved ones with dementia, is the repeating over and over and asking the same questions, even though 10 minutes ago you answered them. And then they could come back yet the next day and say, oh, you never told me that. Or no, I didn't ask you that. Or no, you didn't tell me that, even though you insist. And we'll get into that as the month goes on about communication techniques. But it's not going to do you any good to try and correct them, because their reality is their reality. And when we're caring for someone with dementia, we have to step into their reality versus try to bring them in our reality, because that's never going to happen. Challenges in planning or solving problems, maybe problems paying their bills, wandering, getting lost. They drive the car, you get the phone call and say, I can't find my way back home. And they've just gone to town where they've gone a million times before to the grocery store. Losing things or misplacing things in odd places. Mrs. D had a habit of wanting to put her husband's glasses in a safe place, and he would never be able to find his glasses, and we would find them in her underwear drawer. We would find them in just the most bizarre places, but that was her way of putting them away so they wouldn't get lost. Difficulty completing tasks such as bathing, mood, personality changes, especially, anxiety or just irritability. And again, that goes right along with the increased anxiety and or aggression. They can become more paranoid and just question everything and what's the motive behind what something you want to do for them. And they just can become very suspicious. So some of the things we're going to talk about this month is prioritizing self-care. That brings us to one of the tools that we have. We're getting ready to launch our Blueprint to Building a Care Team on a Budget boot camp, and that's going to come out in July. We'll have more information to follow with that to help you build a care team and try and fill in those gaps without paid caregivers. Just trying to help assemble that team. But the first part is when you're caring for someone, with dementia, is to really kind of look. You get so caught up in the caregiving, sometimes you forget to care for yourself. And so what we're introducing prior to that bootcamp is we've got a free checklist, and I'm going to go ahead and put that in the comments here. And we have a free checklist that's coming out. It's available now. It's a caregiving self-awareness checklist. So it's a series or a set of 3 groups of questions to try and help you assess how you're doing emotionally, how you are doing physically, and what areas of building a care team do you need. So that is free. So feel free to grab that. I'm going to go ahead and just share that on the screen here real quick. But this is going to be our access to our free checklist on self-awareness for caregivers, for those that are caring for someone with dementia. Okay, so let's move on. So we're going to talk about, through the month, we're going to talk about effective communication strategies. Communicating with someone with dementia can be extremely challenging. So we want to remember, use simple, clear sentences, maintain eye contact, and most importantly, patience. Techniques like validation, acknowledging their feelings. When they tell you, I'm afraid someone's coming to the door and they're going to kill me, it doesn't do you any good to say, oh no, there's no one there, because again, that's their reality is their reality. Just like, you have to think about, how would you treat someone if there really was a stranger at the door and there really was a threat? And how would you treat that person? Well, you'd want to treat them the same way, even though that threat really isn't real, because to them it is. So rather than to argue with them and say there's no one at the door, it would be best to say, so and so, I'm here. So and so's here. We're all here together. And I assure you, you're safe. We won't let anything happen to you. I promise. So that's going to go more to reassure them and allay their fears rather than getting an argument with them, trying to tell them that there's nobody there. So that you're not going to win that. And you're only going to ramp up and possibly get to some aggression or behavior issues, or at least case scenario, they might get irritated and agitated. Creating a supportive environment is another thing we're going to be talking about. So it can make a world of difference to someone with dementia. So you want to ensure that the home is safe. Now, like with Mrs. D, we had to, she liked to be busy and she liked to do dishes. Well, she broke a glass one time and cut herself. So we knew that we were at that time, and the granddaughter had told me about that. We knew that we were at the time to do something different. So we removed all the glass dishes, glasses, plates, all of that, and replaced it all with plasticware. And so that we were comfortable that if she dropped something or, while she was wanting to do the dishes, then she was going to be safe. So tripping hazards, we want to look at handrails, night lights, familiar objects, and try and keep routines as familiar as possible to help decrease their confusion and their anxiety. So these are just some things we're getting more into the month. Utilizing support services. So again, you're not alone in this. There are so many. Go to our website and just go to blogs. We're going to have 4 blog posts this month on that. We list lots of resources in our blog posts, so feel free to check that out. We've got dementia care specialists that we have access to, that we're going to share some videos of theirs with some tips and strategies. So look for those. And again, if you are at the point where you really need to help beef up your support team and are looking for ways to do that without hiring more paid caregivers, then maybe consider our boot camp that's going to be out in the middle of July. So, and again, more information will follow on that. Next thing is, legal and financial considerations, planning for the future. So early planning can really go, take miles and steps to prevent future stress. So we want to make sure that their affairs are in order. Financial advisors, as well as estate planning attorneys. We recently lost my mother-in-law, and she was very good about having everything planned. It is still a difficult and overwhelming process, even when things are organized and in place. So if you don't want to get totally overwhelmed, it's so important to have their advance directives in place, have their financial things in order, who are beneficiaries, who's going to manage their estate when they're gone. All these things need to come in play, because when that time comes, it is going to be overwhelming. And to have some of these things in place already for you is really going to help alleviate some of your stress. We just want to mention, we're talking about coping mechanisms and how to cope with people. And we've just, touched on a few things throughout this Tuesday tips. My first experience with Alzheimer's was with my grandpa. I was a new nurse, and he had Parkinson's and Alzheimer's disease, and he was staying in the nursing home. My mom was a nurse's aide, and he was staying in the nursing home where my mom worked. And so it was Easter, and so I volunteered to go get grandpa, from the nursing home, and bring him home for Easter dinner. So brought him home, had an amazing time with him. He enjoyed being around the family. I'm the oldest of 5, so he was there with my younger brothers and sisters, and it was really a great day. Well, then it became time, 4 or 5 in the afternoon, then it became time for us to take grandpa back to the nursing home, and I was going to take him back myself. And I got in the car, my mom opened the car and tried to help him in the car, and there was no way he was getting in the car with me. I was a spy. I was trying to kidnap him. He had this look of terror on his face, and there was no way he was getting in the car with me. Now, some people might have tried to coax him, or, come on, grandpa, you got to get in the car. We got to take you home. Come on, let's go. And that would have made the situation worse. So if you're in that type of situation, your best to just, and what we did is we say, okay, grandpa, that's fine. You don't need to get in the car. Let's go back into the house. So we went back into the house, sat back at the table. Everybody was visiting with grandpa again. And a half an hour later, we tried again. And he was like a different person, got right in the car with me, recognized me, and I took him back to the nursing home. So again, sometimes patience and just waiting it out rather than trying to force a situation, just wait it out, give them some time, and they kind of reset themselves and they forget about what they were thinking about that. So sometimes that's definitely a much less stressful experience for my grandpa. Maybe it was a little frustrating for us because we wanted to get him home and it was on our time but it only would have caused him more fear, more anxiety, more agitation if we were to try to coax him or force him to get into the car. So um, that's kind of where we are going to be for the month, is to sharing some of these information with you this month. So I invite everyone, comment on this Tuesday Tips post if you have questions, or if you have a scenario that you're dealing with, or if you're watching this on a replay on our YouTube channel. Don't hesitate to put a comment in. If you've got a challenging situation, or you have a question to ask, please reach out. We will do our best to get the answer for you. If we don't have firsthand information, we will get that information for you. But just look for this month to have a lot more information and resources and assistance in working with and managing the care of a loved one with dementia. So with that being said, we're going to go ahead and we are going to wrap up another Tuesday Tips episode. Take care, and we'll see you back here soon.